Hi, my name is Dr. Bobbi Peterson. I'm here in Brooklyn, New York at my office, Aces Braces. I went to Howard University in DC for dental school and opened up my first practice in 2008 on Utica Avenue in Brooklyn. Currently, I have a practice here in Brooklyn. I also share a practice in Newark, New Jersey, where I'm originally from, with a pediatric dentist, Leslie Harvell, Dental Kids. I opened up my first practice in 2008. And that, like I said, that was over there on Utica Avenue. And I wasn't owning the building. I rented. I mean, I can go into detail about all the crazy experiences I've had with landlords. So I did that twice. Last year, I decided to buy this building where we are right now, so I don't have to have that headache anymore. So currently, I definitely treat over 1,000 patients combined, orthodontically. Recently, I hired a hygienist to do the cleanings for my patients, which is very, very important with oral health care. I hired a cosmetic dentist, Dr. Black. So now I run a full service orthodontic and cosmetic dentistry practice. So orthodontics is pretty much a specialty of dentistry that focuses on the movement of teeth. We work with oral surgeons to correct jaw positions. There's a specialty that's coordinated with mine called dental facial orthopedics, where we reposition jaws. I work at Kings County. I actually teach at Kings County. I teach general dentists how to do orthodontics, and we like when people in Brooklyn, it's level 1 trauma hospital, you guys know that, and you get your jaw broken or you get shot in the face in Brooklyn, they usually bring you to Kings County so we can pretty much put you back together. So I work with the oral surgeons in that respect. And in my office, what I do is I straighten and align teeth. So if you see people that have like spaces between their teeth, crowded teeth, gaps, any type of malocclusion where your teeth are out of place, you have to see an orthodontist to move them back into position. On a daily basis in this practice, I treat about between 60 and 70 patients. If it's a Saturday, I might see as many as maybe 80 patients. The way I became a celebrity orthodontist, it's not something that I call myself. This is something that my friends and my associates started calling me because they basically referred me to their celebrity friends, and they started to come in and they just loved my practice. They loved how cohesive my staff was. They loved how welcoming and familial my office was. I left out the part that my mom is my office manager. My daughter is my treatment coordinator, and the majority of my staff has been with me for years. They're very loyal to me, I'm very loyal to them. So you feel that when you walk into my office. So they saw that, and then the recommendation started. And that's how the entire buzz started for the most part. So I've treated all types of celebrities in all different fields. I've treated some reality stars, I've treated some football players, I've treated some designers, fashion designers. Sorry, this is literally like my life right here. So yeah, I've treated a lot of people. Also, I inject Botox and dermal fillers into people's faces. So a lot of the celebrities that I've actually treated, some of them, I can't really mention their names or anything because it's called a HIPAA violation. It's unethical to do that. But that is another thing that I actually do. In addition to whitening, we do veneers, we do crowns now, orthodontics, braces, and Invisalign. Invisalign and clear aligners are my specialty. We treat all ages. There are a lot of orthodontic practices that only treat children. Like my practice in Newark, we only treat children or adolescents. And here we treat, my practice here is probably about 50% adults. So if you think that you're an adult and you've had crooked teeth all your life and you think it's not possible to straighten out your teeth because of a certain age, I'll tell you right now, my oldest patient was 70 years old. So whether or not you can get braces is not based off of your chronological age. It's not based off of your age. It's based off of your dental age. So if you have healthy bone and you're 90 years old and you want to straighten your teeth, I can straighten them. Now, in terms of what types of orthodontics I can use at certain ages, that's another story. But can they be straightened? More than likely, yes, if your bone is healthy. Please come in and see me. I am at 1049 Rutland Road in Brooklyn, New York. Book your appointment.